Depression can be a very difficult subject to talk about. Just bringing it up can make people uncomfortable, and those who suffer from depression can clam up and not want to talk about it once you've mentioned it. However, the Brain and Behavior Research Foundation is committed to alleviating the suffering caused by mental illness and by awarding grants to scientific, innovative research that will hopefully one day bring an end and help people cope with mental illnesses. Since 1986, the Brain and Behavior Research Foundation has donated over $360 million to scientific research, awarded over 5,000 grants in 35 different countries, including the United States. The Brain and Behavior Research Foundation understands that mental illness is not quite the same as some physical ailments. It's not always something you can prepare for, and it's certainly not something that there's always a cure out there for. So the Brain and Behavior Research Foundation is committed to donating money to grants and research that cover three basic innovative ideas, beginning with basic research, new technologies, and next-generation therapies. The Brain and Behavior Research Foundation looks to diminish the amount of people affected by mental illness to slim to none. Beginning with basic research, it's important to first understand what clinical depression is. There's a lot of misconceptions and myths about clinical depression. According to the Brain and Behavior Research Foundation, clinical depression is something that is a serious condition that negatively affects how a person thinks, feels, and behaves. And unlike regular sadness, it's something that affects your daily life and can stop a person from being able to anticipate or participate in pleasure. The Brain and Behavior Research Foundation understands that this is a worldwide issue, and with over 350 million people around the globe that have been affected by depression at one point in their life, according to Science Life magazine, they understand that their work is far from over. Dr. Kenneth Keller was awarded a grant from the Brain and Behavior Research Foundation to conduct a study on over 1,000 pairs of female twins to study the effects that our environments have on the forming of mental illnesses. He looked at these female twins that were all diagnosed with discordant major depression, meaning that one set of the twins was diagnosed with depression and the other was not. He studied the effects that their environment had on their ability for their genes to grow and their developmental stages. What he found would lead to a completely new generation and research field called epigenetics. He was able to focus down that the environmental risk factors impact your genetic expression to cause major depression. So simply put, whether that you grew up in a small town where you might feel seemingly alone, or in a large town where you might feel very, very small, or if your environment is a college student where you might be very, very stressed out, and in our adolescent stages where our brains are developing the most, we're at a higher risk for developing mental illnesses like depression. He found that these environmental factors are crucial to understanding exactly what kind of mental illnesses you can develop and how to treat them looking forward. The next innovation that the Brain and Behavior Research Foundation donates grants to is its new technologies. Things like brain stimulation and transcranial magnetic stimulation. Try and say that 10 times fast, I promise. It's really hard. These types of therapies are important for when drug therapy fails. Not all people are able to treat their depression with typical prescription drugs. Some people have to try many, many different options before they can find something successful. Dr. Helen Mayberg performed a research study with funding from the Brain and Behavior Research Foundation. She looked at PET scans of patients with depression and studied the brain. She looked at the scans and was able to identify a network of patterns between brains with the same subtype of depression. The reason why this is so important is because now that we can understand that there are brains with similar subtypes of depressions, we can look for effective methods to treat that specific subtype of depression and not waste time with ineffective treatments. One of these treatment methods that came about because of her study was developed by Chris Bacon of Belgium and Glenn Portis, PhD, a recipient of a grant from the Brain and Behavior Research Foundation. They used transcranial magnetic stimulation to study the brain and how it works. In short, what they did, they took up the patient's brain in the study and they stimulated it with a magnetic field. They then found the circuits specifically that correlate to depression and were able to alter them in order to change the way that the person felt or acted. The main breakthrough that came about because of this study is that the patients that participated were able to see a significant breakthrough in their mood within 1 to 2 weeks. And traditionally, treatment methods can take up to 8 weeks before someone can start to feel anything. And with minimal side effects, such as slight headaches and small pains on the site of stimulation while receiving the treatment, both doctors are very confident that this will be a method that we will see in the future as they start to learn more and more about it. Lastly, the Brain and Behavior Research Foundation provides funding for next-generation therapies. The goal ultimately is to reduce the amount of people affected by mental illness to slim to none. Looking for treatments and preventative methods to minimize the effects of mental illness at the source will cut it down in the most effective fashion. Carlos A. Zarata Jr., MD, got a grant from the Brain and Behavior Research Foundation and performed a study to look into new and improved fast-acting antidepressants. His study would be heralded as the biggest change into the treatment of depression in over 50 years. Zarata studied the effects of microdosing ketamine to patients with treatment-resistant major depression. For patients that had tried plenty of methods before but had never been able to be properly treated, he used microdosing of ketamine, and these patients were able to notice a difference in their mood within hours of the treatment. Although in still the very, very early stages, ketamine is a drug that has a lot of misconceptions about it, and there's still a lot of worries before it. But Dr. Zarata Jr., MD, is very, very positive that with continued funding and more research, that ketamine at one point will be able to treat people with depression where treatment methods have not worked before. And in another study, Bodhi W. Dunlap, MD, Helen Mayberg, MD, and W. Edward Craighead, PhD, participated in a study where they took 122 patients with previously untreated depression. So they got a fresh look into brains that had never seen the treatment of depression before. They took MRI scans of these 122 patients and studied the brain scans before they got any treatment. They then gave the patients one of 3 different kinds of treatment. One of 2 different kinds of antidepressants, or a form of talk therapy. After receiving treatment, the doctors went back and did another MRI scan to scan the brains again to look at the difference. They then correlated the initial brain scans with the type of treatment that they got, and then the results from those scans. And remember the study we talked about earlier where we were able to identify different subtypes of depression? This kind of research is so crucial to making sure that we give people the exact kind of treatment they need to shorten recovery time and to help avoid ineffective treatments. The Brain and Behavior Research Foundation is a huge charity with wrap all around the globe. They have the ability to reach everyone, and that is why it is so crucial to continue to support them. By one, they're helping them investigate into new basic research, to new technologies, and to next generation therapies. By supporting the charity, you can help do just that.